My name is Cheryl Esberg and I am an occupational therapist.
My name is Amy Pollock and I'm a physical therapist.
The video you are going to see was filmed at the Medical Intensive Care Unit at the University of Chicago Medical Center in partnership with the Society of Critical Care Medicine.
Patients who are critically ill may require mechanical ventilation as well as sedative and analgesic drugs to keep them comfortable while they're recovering from their acute illness. Unfortunately, medical recovery can take days to weeks, leading to prolonged periods of bed rest.
Subsequently, critically ill and injured patients often suffer from profound neuromuscular and neurocognitive changes. These deficits have been shown to be quite long-lasting and not only impact the patient, but caretakers as well. Patients can even have difficulty with everyday activities such as grooming, brushing teeth, bathing, and walking. Protracted rehabilitation is very common, especially in patients who receive mechanical ventilation and sedative agents.
Thankfully, there's been recent support of sedative-sparing strategies to allow patients to interact and engage with their environment, despite the need for life support devices and medications. Recent research has shown that early participation in occupational and physical therapy is feasible and safe. These patients return to pre-morbid functional independence sooner and are more independent with activities of daily living and ambulation. It has also been shown that early physical and occupational therapy involvement reduces days spent with delirium by half and can reduce ICU and hospital lengths of stay.
Despite the evidence supporting this intervention, the process can be complex and challenging. It is a true example of interdisciplinary involvement, including therapists, nurses, and physicians. There are many considerations to implementing an early mobility program, including communication, coordination, and competency. Our goal of this video is to demonstrate how to mobilize critically ill patients effectively and safely. The slide and audio presentation that accompanies this program will articulate tips on how to get started and why it is important.
Thank you for your attention. We hope this video is informative for your team.
Yeah, we started this as an offshoot of a philosophy towards reducing sedation in patients who are undergoing mechanical ventilation. Getting patients up and mobile, it requires them to be mentally aware, because if you're sedated, it's hard to be very mobile. So having done research in the past on reductions in sedation, we asked the question, if we extend this to the next natural step, which would be getting patients active physically, could we make an impact? The problem that we see in patients that are critically ill that require mechanical ventilatory support is during that period of illness, they tend to stay in bed relatively motionless for prolonged periods of time. And when we look at the outcomes of patients after critical illness, we see that they have substantial degrees of weakness, deconditioning, neuromuscular dysfunction that inhibits their ability to function the way they did before they got sick. So looking at strategies to reduce sedation lended itself to an opportunity to try to expand on that. There are differences, of course, in the way they're done. I think the fundamental concept is probably more important than the details as to how you do it. It depends partly on your culture. I think it depends partly on the institution you're working at. At our place, we do daily awakenings. That's the research that we did ourselves a number of years ago. It's simple. If you have staff that are in tune with that, it works quite well. If you have staff that aren't familiar with that strategy and are more accustomed to algorithmic reduction in sedation, I think there's a role for that as well. So I think both of them work. It's a matter of how you prepare your team in a multidisciplinary role to move forward. But the bottom line is having a patient who, at least for a portion of the day, is able to be awake from drug effect and interact with the environment in a purposeful way is the key foundation to the idea. When we did a study 2 years ago and looked at early activity, we found that early activity reduced ventilator time and trended toward reducing ICU length of stay. In waking patients from sedation in previous work, those same two findings have been noted. We haven't looked at cost directly, but it stands to reason that if you reduce time in the ICU and reduce time on the ventilator, there's going to be a substantial cost reduction, since those kinds of therapies are inherently very expensive. So getting patients up and moving, awake, mentally, active physically, reducing ventilator time, getting them off the ventilator sooner generally translates into getting out of the ICU sooner. The key first thing is you have to have multidisciplinary buy-in. So the physicians have to agree that this is something that they wish to do if they aren't already doing it. Likewise, the nursing staff. And then once you have buy-in from nursing staff and physician groups, then you have to have champions that continue this type of strategy and move it forward. Therapy teams, so physical therapy, occupational therapy, respiratory therapy are the three that are probably the most important that come to mind for this kind of activity, that is early activity during mechanical ventilation. And then having a person or people who continue to address this issue and bring it forward to house staff and care providers so that it's on the radar screen, so that patients get this type of therapy on a regular basis, that you don't lose the initial enthusiasm for it as time goes on.
So we got a referral today for a patient who is an 89-year-old female. She was admitted 3 days ago with respiratory failure from hypercapnia. She has a history of metastatic breast cancer that she had chemo and a mastectomy for. So she was admitted with septic shock. And she doesn't have much past medical history other than the treatment for her breast cancer. I looked at her labs, all her hemoglobin, electrolytes, everything looks fairly good. Her vitals also look fairly stable. Talked to the nurse. She's on just a little bit of propofol, but awake, following directions, ready to kind of participate with us. So
I talked to the family. There's a daughter in there, and she said that the patient was independent before coming into the hospital. She would occasionally get fatigued and have a little bit more trouble going distance, but otherwise could independently get herself around.
okay, good, great. I think we can start with her then. Squeeze my hand over here. Good job, sweetie. So your daughter was telling us that at home you were doing pretty good, walking, doing everything for yourself, is that right? Good. So we know you have this breathing tube in, and I know it's uncomfortable, but we should try to sit up a little bit, see how your arms and legs are moving, kind of go from there. Is that okay? Is that a yes with the squeeze? Okay. We'll try. Hang on. You gotta wait for 1 second, okay? So we're going to move some things and get them arranged so we can get you moving, all right? And we'll get you sitting up on the side of the bed. It's going to help when you sit up if you tilt your head down a little bit. It'll keep you from gagging, all right? Can you wiggle your toes? Let me see. They look pretty. Somebody got a pedicure, huh?
Yes, she did.
Can you bring your foot up towards your head? Yeah, good. Can you push down into my hand? Push. Like you're stepping on the gas. Push.
Want to stand right here?
Sure.
Can you bring this foot up towards your head? There you go. And point it down, all the way down. Point your toes. Good. And do the same thing over here. Can you bring it up? Bring this foot up. Like that. There you go. And point your toes.
Down. So you said you're here often?
I'm here all the time.
Are you?
Obviously, my husband comes out, go home and shower, and then I come back.
That's great. So obviously, when you're at home doing things, you're moving around, doing your normal everyday tasks, and that's almost like exercise. And so when you're laying in bed, you have this breathing tube in your mouth that makes things hard. It can become confusing. And so the more that you can kind of reorient her, tell her what day it is, have her do simple things like squeeze her hands, move your legs. You can even have her, raise up her arms. Do those basic things. That will help. She has a lot of swelling too, and so your muscles act like pumps, and so when you move them, it will help kind of push that fluid back up to where it needs to go, and keep her from getting weak.
Okay, we're just going to sit, okay?
Try to take nice deep breaths, okay? Just sit here for a minute. Try to tilt your head down a little bit, just like that. See if that helps with the gagging, okay? Here, you can hold my hand. Nice deep breaths. Just sit here for a minute.
On the count of 3. 1, 2, 3.
Oh,
Nice job.
better.
Stand tall.
Look
Good.
up. Maybe can you take some steps towards me? Yep. Good. Big steps. So shift, over. Good. One more. Good job. Can you try to lean forward?
Bring your weight forward over
There.
your feet,
Come tall.
but keep standing tall. There we go. You feel tight in your legs?
Yeah, it's a little
Give them
stretch.
A little stretch, okay?
Can you pick up your feet?
March a little bit.
Here, so pick up that right foot. Yes, good. How about the left? Good. This is better today. Do you feel good?
Can you take a step to your left?
Here,
Take
up
a
towards me.
Side step towards Cheryl.
So bring that foot. Yep.
And
Good.
now bring the other one. Good. One more.
Big step.
One more step out with your left.
You getting tired?
Okay.
This is really good.
All right.
Yep.
Go. Take a rest.
Nice and slow. So bend. Use
You
your
gotta
legs.
bend your knees.
Good.
We're gonna get one more blood pressure, okay?
You okay? Good job. High five. What's that?
Can you bring your foot up towards your head? Yeah, good. Get a good stretch back there. Is this where you feel tight? Yeah. Good. Now point your toes all the way down. Bring them up again. All the way up. Hold it there. Put it down. Can you do that periodically throughout the day? Remember to do that with your feet? Okay.
Up all the way. Raise this arm up. Yep. All the way. You want to stretch, stretch, stretch. Same thing, do you feel tight? Can you let it go back? There you go. Does that feel good? Good. Can you relax?